Thank you so much, Reverend Daniel, for inviting me and for giving me a chance to speak to the conference. Thank you all to everyone who's here on the line. And as Reverend Daniel stated, please feel free to put questions into the chat so that we can really try to have an interactive discussion. I typically have a PowerPoint presentation that I do, but at this stage, I think everybody has kind of heard a lot of the basics and the ins and the outs. And, we've been doing this for the last 18 months. So a lot of that information people already have a pretty good understanding of. And so what I really wanted to do was just kind of come on and just have a dialogue and, and try to answer questions and try to share the experiences that I've had working with patients with COVID and experiences that I have seen in my own family, my husband's family, and just really try to share whatever information it is that I have to, allay any concerns that you may have with regards to the newer strains of the virus that are coming out and with regards to vaccine safety. And I just wanted to kind of give a little bit of background information about myself first. So I am a general pediatrician. I am a pediatrician at Kaiser Permanente in Fairfield, California, which is in the northern part of the state. And I'm also the assistant physician in chief for culturally responsive care and inclusion. So as part of my role with culturally responsive care and inclusion, I've really been working very diligently with my team of colleagues to try to go out into the community in a virtual sense and again, have sessions, join sessions that are already taking place or have other informational sessions, particularly for our communities of color, because we have been the ones who are disproportionately impacted by the virus and also the ones who are less likely than our Caucasian colleagues to feel comfortable receiving the COVID vaccine. And so this has kind of been the groundwork that I have been doing really since last October. And so again, I'm just really excited to be here with you all today and be able to kind of engage in some dialogue and answer any questions. And with the view that I have, Reverend Daniel, I don't see the chat. I don't have the chat box open. So, definitely feel free if you see something pop up to please just go ahead and ask. And I know we had corresponded with regards to some of the most frequently asked questions. So I wanted to just give you a chance to kind of ask anything right up front as we're getting started before the audience is maybe warming up and putting their questions into the chat.
Some of the things that you share that came up regarding COVID is that, the effects that it might have on people. And one of the things was that you might not be able to have children. It may affect that. And then just the other areas of your body that it may affect long-term,
And just to clarify, meaning possible side effects from the vaccine or from COVID itself?
Side effects from the vaccine.
Okay.
But I know there's a lot of things that are happening to people that do have the COVID and they maybe have some long-term issues.
Right, exactly. Thank you. That's a really great starting point. So as the pastor mentioned previously, there's a lot of information that's out there, and I'm sure that people have probably seen and heard and read a little bit of everything with regards to COVID, the COVID vaccine and what the side effects are. As a pediatrician, one of the questions that I've really been getting most frequently is this going to have an impact on my child's fertility as they get older? And a lot of younger people are concerned about that as well. So fortunately, we know that none of the COVID vaccines that are currently available are showing any type of impact on people's ability to have children. In fact, in the original study that started last summer, there were 40,000 people that participated in the study for Pfizer, which was the first vaccine that was approved. And out of that 40,000 people, many of the women in the study actually got pregnant during the trial. And since that point in time, they've had their babies. The babies have been fine, and they're still following all of these people from the study that started last July. And again, 40,000 people, that's not a small number. And there were about 15% of those people who were Black or African American. So it wasn't just kind of a random group of people who didn't share any possible similarities to all of us here on this call. And, again, they've been following the women who were pregnant, the women who had children, and just making sure that they have been okay this whole time. They're checking them monthly and everybody has done fine. So we can definitively say that no, there are not any side effects that can cause you to not have children or impact your ability to have children in the future, and no adverse impact on the babies once the babies were born either.
I have another question here from Reverend Young. Does the vaccine keep you from getting COVID-19 and passing it to others if you are infected?
That's a really great question. And so that's actually something that we have been talking with people about a lot these last few months. So the vaccines, the Moderna and Pfizer vaccines are both over 95% effective at keeping you from getting COVID-19. And remember, at this point in time, there's COVID-19, but there are also several variants that are out as well. So there's the Alpha variant, the Delta variant, which is the one that is kind of the largest one in the country right now, as well as two other variants that are kind of circulating in the country and in the communities. So just kind of think to yourself that even if you were a person who had COVID-19 last year, you can still catch one of these newer variants that are out and that are more contagious than the original strain was. And so if you get vaccinated, we found that the vaccines will protect you from getting COVID-19, any of the newer variants that are coming out thus far. So you are protected yourself. Now, as to whether you can possibly be a carrier and pass COVID to somebody else if you are not, possibly taking precautions, that is something that has been shown in a very, very small percentage of people, but it is a possibility. And so that's why it's important, especially if you're engaging with people, in your household or other loved ones who are not able to get a vaccine because they're too young or because they have medical conditions that prevent them from getting it, that if you're going to be engaging with other people who are unvaccinated, that you want to make sure that you are still taking precautions so that you don't inadvertently pick something up and then physically bring it to that family member or that loved one, even though you don't get infected yourself. So I use myself as a prime example. As I said, I'm a pediatrician, so I'm seeing kids, younger children all day. So the majority of the patients that I'm seeing are not even old enough to get the vaccine. And I have a 6-year-old daughter and an 8-year-old daughter at home. So as soon as I come home, first thing I do, change my clothes, wash my hands, leave shoes at the door, take a shower, all of the above. I'm like, girls, don't touch mommy until mommy has taken a shower and gotten myself all cleaned up, because I want to make sure that I don't possibly bring something to my girls. And my husband does the exact same thing. We both received our vaccines, but again, we've got those little girls that we're being cautious about. So that's a great question.
Thank you. Deacon Harris has a question. Is there a link to socioeconomic and those who refuse to get vaccinated? If so, why?
That's another great question. You all are coming with the great questions this evening. I'm excited about this. We're going to have a good conversation this evening. So thank you, Deacon, for that question. Yes, there is a direct link between socioeconomic status as well as ethnicity, as well as a physical location, like what community you live in vaccination status. Because what we've seen, even from the very beginning of the pandemic, is that we have groups who were already disproportionately impacted by chronic diseases. And I'm sure, everyone here probably knows somebody who has diabetes, who has high blood pressure, who has renal kidney issues, who has any of those kind of like chronic diseases that can put you at an increased risk of getting a more severe COVID infection if you actually do become infected. And unfortunately, people of color are disproportionately parts of lower socioeconomic groups. The other thing to consider is the fact that people of color are also disproportionately essential workers. So last year, when many of the states shut down and many people were able to work from home and work remotely and not have to expose themselves to other people, communities of color did not, for a large majority of people across the country, did not have that luxury. So if you still had to physically get up and go to work, and do your job, and you're exposed to other people, particularly if you are working in a space that did not kind of really provide good precautions for you as a worker, then that increased your chance of actually contracting COVID from somebody. The other thing to consider is that people of color tend to live in multi-generational households as well. And so again, you have the adults who were getting up and going out to work. You may have had children who had to go to daycare or who had to go to childcare because their parents had to go to work and couldn't afford to just sit at home with them. And so then these children are now exposed to other children who have been exposed to their parents who are going to work. So that whole, it's a lot of layers that are involved there that put us, unfortunately, at a higher risk of contracting COVID. And then again, you add in those chronic conditions. So then if we contract COVID, then we do have a higher risk of having a more severe case, a hospitalization, or even death. I was just looking up some figures for an essay that I'm writing for African American Professional Association here. And here in the state of California right now, for African Americans, the death rate is 9 times higher in the state of California. Across the country, pretty much throughout the entire pandemic, African Americans have had about a 3 times higher chance of dying from COVID compared to a Caucasian person. So I know that was a huge mouthful, Deacon. It was a long answer to a short question. But again, you guys are really getting me revved up here with these great questions.
Okay. And then Sister Kelly has a question. In the Black church, singing is such a large part of our worship experience. How safe is singing as a praise and worship team, congregational singing, especially with Delta, Alpha, and Gamma variants?
Yeah, no, thank you, sister, for that question. That's a wonderful question, because one thing that we have found with COVID is that it is spread through droplets. And so, we think of a droplet, we think of somebody spitting on somebody. So it's not necessarily like that type of a droplet, but these tiny microscopic droplets that even just as I'm talking are floating out of my mouth and floating across to the computer, floating across to the other room. So now if I'm yelling or if I'm singing or speaking more forcefully, then those droplets are going to go even farther than they would, if I had a mask on. And that was the whole impetus behind wearing a mask. So essentially then those little droplets that carry the virus are not able to be transmitted from someone's mouth or from someone's nose. And we know that the droplets can't penetrate through the cloth that you have or whatever type of material that you have with your mask. And so going back to the question about singing, so singing, is especially, the way that we like to do in church, singing can be very vigorous. It's a forceful thing, and it's something that's just traditionally, of course, part of church. I grew up in a Baptist church. My husband is an AME minister. And so you equate church with singing. But, if you have a choir or a praise team who has not been vaccinated and they may possibly, have the infection and maybe they're not showing any symptoms, maybe they don't know, then there's always that possibility that through the act of singing that those droplets can be, passed along to someone in the congregation. The way that, and of course, this is something that every church kind of has to approach individually with regards to how are they best going to praise and worship, as well as making sure that the praise and worship team and anyone who's in the congregation, the ministers in the pulpit, et cetera, that anyone is going to be safe. And that's actually something that my husband and his team of stewards have been working on for the last month and a half now, is figuring out how to reopen our church in a safe manner so that we are continuing to worship and praise, but then on the same hand, making sure that we have that responsibility to the congregation to keep people safe. Because again, there are going to be people who either have chosen to not receive a vaccine or who have not been able to receive a vaccine. And so it's that balance, that fine balance of trying to worship in a safe and responsible manner and still keep everybody safe so that everyone can enjoy that experience without having to worry about getting sick.
And I wanted to mention, part of that question was if all the singers are vaccinated. And so I think you addressed, yeah.
Yeah, so I mean, I'm sorry, go ahead, Reverend Daniel.
That's okay, that's it.
Okay, so yes, so if all of the singers are vaccinated, then that's, definitely a great step to decreasing the chance that they could possibly pass something to someone because they're up there singing or what have you, and we're not kind of talking about that contact that we discussed when I said, I come home from work and I'm changing clothes and washing hands and doing all of those things. So you definitely decrease your risk significantly if your singers or if, people who are on the praise and worship team, people who are participating in the service are vaccinated.
Thank you. What this next person wants to know, it says you may or may not have an answer, but the latest discussion related to the vaccine is that there are ingredients found in sunscreen also present in the vaccine, one in particular. What truth can you share regarding this report?
Mm-hmm. Now that's honestly something that I have not read up on yet. I know that the sunscreen recall has come out fairly recently for several sunscreens that were produced by Johnson and Johnson. And all that I've kind of done with that information is just checked my children's sunscreen and made sure that theirs was not on that list. But as to kind of cross-checking with the Johnson and Johnson vaccine or looking at any data, that I honestly have not done thus far.
Okay. The next question is, I know someone who tested positive a few months ago and lost their sense of smell and taste. Are these permanent?
And that is something that at this point in time, we really do not know. Unfortunately, for people who have gotten a COVID infection within the last year and a half, you all may have heard the term long hauler syndrome, or like the long haulers. And I know they're just now starting to do a study with some of those long hauler people now, but I mean, they're literally people who had an infection earlier this year or even last year and just have not been able to get back to 100% yet, despite the fact that they survived. They still have something that has not quite come back yet, whether that has been their taste of their sense of smell or their taste. I've heard of patients just anecdotally from my adult colleagues who treat adult patients in the intensive care unit. One of my colleagues is a cardiac intensivist in our area, and he treated a young African-American man in his 30s, was hospitalized in January. He was on the ventilator, and actually his case got so severe that they had to use an ECMO machine. So basically that's a machine that had to take his blood out of his body in order to oxygenate it, because he was not able to get oxygen from the ventilator, the tube in his throat. So he was on that machine for Dr. Alex told me about 2-3 months. And they, of course, didn't think he was possibly going to pull through. He ended up pulling through, ended up being discharged from the hospital. He was in the hospital for 5 months, and he is still on oxygen now. So again, he's alive, he's at home, but this young, otherwise previously totally healthy young man in his 30s is now on oxygen, and they don't know whether or not that is going to be something that is permanent. One of my friends, prior to getting her vaccine, she and her entire family actually contracted COVID, and they were infected back in November, December, and she's still having symptoms of fatigue and body aches and pain, and still has not been able to return back to work. So there's really so much that we do not know, and unfortunately, some individuals who have contracted the infection or contracted the disease, we don't know if they're going to ever get back to their normal. And it's not even just kind of their physical and mental well-being that we look at, but also their financial well-being. Are they going to be able to get back to work and do their regular jobs so they can take care of their financial responsibilities? Are they going to be able to take care of their children, or their grandchildren? So that, again, there's all these different layers that we just don't have answers to yet, and we're still kind of learning as we go. Fortunately, we know a lot more now than we did at the beginning of the pandemic, but unfortunately, that doesn't necessarily help those people who are kind of in that long hauler group.
Thank you.
Mm-hmm.
Another question is there going to be any booster shots necessary?
Yeah, that's a great question. So this has been a discussion for a while, and I actually did just read up on this morning. So this information is fresh from looking on the CDC's website, in which they are updating on a regular basis, and your State Department of Health websites are being updated on a regular basis as well. So those are really great sources of information. At this point in time, they are still stating that we are not sure whether or not a vaccine will be required. Whether or not a booster vaccine will be required, especially because of the fact that even with these newer variants, and the Delta variant was just found here in the United States in March, and this was a variant that really swept through India last December and killed all those people in India. So it's just came in March. already here in July, this is the predominant variant across the country. However, with the majority of the people who have caught it have been unvaccinated. And so with kind of studying these people as well as the people who've been vaccinated, they're still finding that everyone who received vaccines, 95, 96% of people who receive vaccines have been able to be immune to even the Delta variant, which is more severe. There's also now, I'm just going to throw this out here, especially because this is a church conference and of course, social justice and things like that are very important within the faith community. So part of this discussion is it ethical for us to receive booster vaccines when there are still countries there are still countries throughout the world who have not even been able to receive their first vaccine because they've not been able to afford to purchase the vaccine from the manufacturers. So that's, again, another kind of level on top of that. If we have people who are dying because they couldn't even have access, and then we turn around and say, okay, everybody here in America and these other wealthier countries, we're going to go ahead and give you a second dose when people haven't even had a chance to get their first dose. So that is actually part of the discussion as well. So again, a long answer to a short question, but at this point in time, there are no booster shots that are being recommended currently, but the research is ongoing.
When you talk about those other countries, I was just on a call at 2:00 or 2:30, and we were talking about Cuba and maybe even the Philippines, where persons they're trying to get needles, to inject the vaccine, and they're trying to, but then Cuba they're banning it or something, or the United States is not agreeing to send it to other countries, or so. With this group, they're talking about this, how can we help other people in other countries if our country is banning us from mailing anything to like I say, if you know what, like the APRR group, the union workers, the longshoremen and whatnot, they want to ship something over.
Mm-hmm. And just to clarify, Reverend Daniel, are you asking in a hypothetical sense or kind of in an actual, like, what is actionable type of sense?
Kind of what is actionable,
right.
as far as any, because I know that as doctors and nurses, you have a Good Samaritan, and it should be worldwide, not just, in the city that you live in,
Exactly. I mean, I do know that the government has joined forces with several different countries to kind of ship vaccines to several underserved countries. I don't know I can't off the top of my head say exactly which countries those are, but I mean, I think that one thing to do would be to kind of just check in with some of the local larger community organizations, particularly those that do mission work or do mission trips or medical missions or things like that, and see what the plan is. Because I would imagine that those groups who typically would engage with other countries for medical work are probably trying to strategize to bring vaccines to people in those countries.
Okay, thank you. Do you recommend that children and teen ministry continue to wear masks when gathering?
I do think that it's a good idea for children and teenagers to continue with the masking because, again, anybody at this point in time, the Pfizer vaccine is the only vaccine that's approved for ages 12 and up. And so if you have teens who are unvaccinated or children under the age of 12 who are unvaccinated because they can't be, then they are just as susceptible to getting COVID as an adult. And so, that's definitely something that we don't want to start seeing is these large groups of children becoming infected because they're not taking appropriate precautions. And even as an adult, if you are not vaccinated, you still want to make sure that you've got that mask to protect yourself from any droplets, and that you're doing your hand washing and really trying to kind of practice those measures and that distancing if you're indoors and if you're not kind of with your family members. The other thing I was going to say, I'm sorry, I lost my train of thought. I had one other point to kind of go along with that, but I don't recall. But yes, I mean, what I was going to say is any virus is going to mutate in order to try to keep itself alive. And so that's what we're seeing with the COVID virus, is that it's mutating and changing, and it's also trying to find a place to go. So as the virus basically encounters more adults and more people who are vaccinated, then it's naturally going to try to find and seek out those people who are not vaccinated so that it can continue to live. That's what viruses do. And so I think that probably, more than likely throughout the remainder of the year, we'll start seeing pockets of infections in groups that have not been vaccinated, whether those are communities of color, whether those are children, whether those who are, people who are incarcerated or in homeless shelters or what have you. So we definitely at all costs want to make sure that we are for sure protecting our children from becoming those pockets of a vector for a virus that's just trying to stay alive.
Thank you.
Mhm.
Next question is, what additional recommendations would you suggest for the church to provide for the elders who wish to return but are yet anxious concerning the unknown?
Mm-hmm. Yeah, I mean that again, it's such a good question, such a layered response, because it's also not kind of a one size fits all, because what kind of works for one church and one congregation and even one physical church building may not necessarily work for another church building. So, I mean, what I would definitely recommend, first and foremost, is just to make sure that there is that conversation between the church leaders and the members of the congregation, so that there is, kind of a good sense of what the concerns are, and also kind of how to best make people feel comfortable. So whether that means, and again, just, this is going to be variable, but whether that means temperature checks, whether that means masking, whether that means distancing in the pews, whether that means everyone who's singing have to be vaccinated. I mean, again, just throwing different things out there, but that's really going to have to be a really big, thoughtful, mutual decision between the church leaders and the members of the congregation. Because just as we said, we want to protect the children, we also want to make sure that we protect our elders. And even those in between, those who are neither the young people or the older people, the people who are smack in the middle. Because the other thing that we've been seeing is that a lot of seniors have been receiving their vaccines, and even in communities of color, African American, Latinx, Native American, et cetera, people over the age of 65 in communities of color have been vaccinated at higher rates than those who are under the age of 65. And we definitely want to make sure that, that our middle-aged people are not susceptible to something that, again, they might bring home to their children, or, pass along to an elderly family member who was not able to receive a vaccine for one reason or another. So it takes a lot of discussion. My husband actually sent a survey out to the congregation, just asking people various questions, like with regards to their comfort level about listening, about would they return to church if there was no singing? How would they feel if there was singing in the church? How would they feel if we didn't get up and go around the offering plate for offering? How would they feel about you just having to sit in a certain space or wearing a mask? So all those things you just really want to make sure to talk about, so that you have a plan A, a plan B, and a plan C.
Okay, so D and the E and F.
And D and E.
And so also a question came up about, and they don't know if you can speak to this, but about the impact of CEO Bernard Tyson on how he helped transform healthcare in America by helping bring issues of equity into the mainstream.
Mm-hmm. And so just kind of what was Mr. I'm looking at the question now. What was his impact? I will definitely say, as someone who had the pleasure of hearing Bernard Tyson speak in person, wow, he was dynamic. Such a great leader, such a huge loss. Literally, the week that he passed, we had just had a conference about a week or two prior to his passing, and that was when I heard him. That was the last time I heard him speak. But I think that he was someone who was a really great visionary, someone who really wanted to make sure that healthcare was given in an equitable fashion, so that people were not left behind due to their socioeconomic status or due to, their lack of access, and that we tried to do whatever we could as an organization to meet the needs of all of our patients, regardless of who they were, where they lived, et cetera. So I really, would say that Mr. Tyson was a huge influence on our organization. He's definitely missed, but I think that he also set forth a really great blueprint that we have been able to continue to follow, so that we are really bringing to the forefront equitable care for our patients.
Thank you. We have another question, not regarding the COVID, but has there been any further research for individuals with lupus?
You know what? Now that I've not specifically. Is this, just to clarify, individuals with lupus as far as their ability to receive the COVID vaccine, or just in general?
It looks like in general.
Okay. So since I'm a pediatrician and I'm not a rheumatologist, either for adults or for children, I don't specifically have an answer for that.
Thank you.
I'm sorry.
The next one is, I read an article today that says we are now in an epidemic and that eventually we will all get the virus. The real concern is going to become how protected we will be. Those that are vaccinated will have a higher likelihood of not only surviving the virus and future viruses versus those who have no protection from the original vaccines before the next mutation.
So basic, and I'm kind of looking at Sister Bell's question as well. So essentially, I think the main question is just kind of how protected will we be? So I think if we not only necessarily look at COVID, the COVID virus, but if we kind of look historically at viruses that I am familiar with, because I'm a pediatrician, so viruses such as measles and polio, and hepatitis B, and things that used to really devastate people years and years and years ago, before we had vaccines to prevent those illnesses and those infections. Even chickenpox, nobody gets chickenpox anymore. I had it as a child, but now we have a vaccine to protect kids from getting chickenpox. So essentially, just kind of looking at the history, again, not only of COVID, but of viruses, period, is that what we found is that once we are able to identify a virus that is really kind of wreaking havoc on the population, and you are able to give people a vaccine to prevent the majority of people from getting this virus, then that does kind of have an overall benefit to the greater population. Because again, like in the 30s and 40s, when everyone was getting polio and children were being paralyzed, and you've seen those pictures, you might have seen those pictures of people in iron lungs in these big buildings, and rows and rows of people in iron lungs because they were paralyzed and couldn't breathe on their own. So that's something that fortunately we never have to deal with now, because after the vaccine came out and the majority of people began to get vaccinated and protected, then again, like we said, going back to the virus trying to stay alive and trying to find a place to go, there are many fewer places for that virus to infect, many fewer people for it to infect. And so essentially it just kind of dwindled down. I mean, I've been in practice for 13 years now. I've never seen a child with polio, and probably never will. And so I, definitely hope that as we're kind of going forward with COVID, that in years to come, that, we'll be able to say, okay, several years from now, be able to say, okay, I haven't seen a COVID patient in over a year, or I haven't seen a COVID patient in a decade. I would definitely love for that day to come, because for those who get it, it can be potentially very devastating.
I was just wondering, there was an incident when you talk about like polio and whatnot. A person that had polio, and then when she went to college, they were giving out the polio vaccine, and so she thought it'd be a good idea to take the vaccine, and then she wound up being worse than what she was. And so so for that, I can't really specifically speak like on that incident, because of course I don't know the patient's clinical course or anything like that.
But I mean, or even kind of what was going on with the polio vaccine at that time years ago when she received it. But I know for sure that as they're continuing to do these studies with COVID, that they are studying people who had COVID already and who received the vaccine, and just continuing to kind of follow everybody to make sure that there aren't any adverse side effects, or if there are adverse side effects from the vaccine, particularly for someone who already had a case of COVID, that they're reporting that and studying it. And so, for that reason, I would say it's like this instance, I think is a little bit different just because of all of the intense studying that's being done. If you really think about last year, like essentially once the pandemic started around March, April of last year, all other research completely stopped. So all research that was being done on cancer and other infections and lupus and this and that and the other stopped. Everyone who was a scientist turned their attention to this brand new virus. Because if you really think about it, like nobody, think of all the people who've had their PhD or done research in a certain field or a certain study, nobody had a PhD in COVID. Nobody learned about COVID in medical school. No one had ever seen this or knew what it was. And so everything came to a total standstill to really be able to understand what this was and understand how best to treat it. So it was basically, it was 60 some billion dollars of research was pumped into this last year. And this is ongoing again, as I said. So I think that just again, with that degree of scrutiny, things are definitely it's a lot different than years ago, even with the polio vaccine example that I gave.
Okay.
Mm-hmm.
So those are, let's see. I believe those are the only questions we have at this time.
Mm-hmm. Okay. All right. Excellent. Well, I mean, again, I just wanted to really thank everyone for your engagement and for all of your wonderful questions. And I hope that I was able to allay some of those concerns that a lot of people have had with regards to the vaccine. Because at the end of the day, what we really want is just to be healthy. We want our communities to be healthy. We want our communities to flourish. We want to get, as the pastor said, we want to get back into church. Get back to seeing each other, our gatherings, all the things that we have been used to doing. We want to be able to do those again in a safe fashion, traveling, all of the above. And at this point in time, one thing that we've been able to see over this last year is that the COVID vaccines that are available are safe, they're effective. And if you have specific questions about your own medical condition, then I definitely encourage you to please follow up with your doctor and talk to your doctor or your nurse practitioner, whoever your provider is, because that's someone who knows you best. They know what medications you take, what conditions you have, and they can really help to guide and direct you so that you can make the best decision. Because again, we all just want to be able to gather again safely with each other.
Thank you so much. I don't know if there's any other comments that anyone wants to make, because we have a little bit of time left here.
There was another question from Reverend Young in the chat.
Okay. Which vaccine do you recommend for children 12 and up? Has there been any complications with children who have received the vaccine?
So the Pfizer vaccine is the only vaccine that is approved for children 12 and up. The Moderna and Johnson & Johnson vaccines are only approved for people who are ages 18 and up. And so, like, with regards to complications for those children and teenagers who have taken the Pfizer vaccine, one thing that you may have seen or read is a complication called myocarditis. And so that's something that they've seen in several teenagers after they received the vaccine. So what that actually means is that there is an inflammation of the heart muscle. So it doesn't have anything to do with the chambers inside of the heart. It doesn't have anything to do with the blood vessels. You can have, anything with the itis is basically irritation. So you could have a irritation or inflammation of your shoulder muscle. So out of all of these kids who developed myocarditis, essentially none of them were hospitalized. They just developed some discomfort in their chest and they were treated with ibuprofen. And that was it. They didn't have to stop their regular activities or anything along those lines. And again, it's not going to impact how their heart is functioning or pumping, but it's just a soreness, the same way that you could get a sore muscle if you worked out too hard or if you kind of exerted yourself. So that's really been the main complication that has been seen. And as I said, there's an electronic adverse outcome or electronic side effect reporting system that is in place throughout the whole country. And so essentially, as a physician, wherever you are, if you see a patient with the side effect, then you put it into this electronic system. And so this is being monitored on a regular basis by the CDC and by the regulatory departments at the government. And so, again, that's how they can kind of say, okay, this is not just happening here in California, but we're seeing kids in multiple parts of the country with this, and then can kind of come together and see like the severity, the treatment, the complications, and then make recommendations based off of that. The last thing I'll just say is, if you remember back in April, Johnson & Johnson was held because there were women who were identified with blood clots. And they essentially stopped the administration of the Johnson & Johnson vaccine because of the fact that these physicians who were treating these women entered this into the side effect database. And then they were able to stop everything, really go back, examine and see what was going on with each individual, and then put together a task force to determine whether or not it was safe to proceed. And I know, unfortunately, that when they stopped giving Johnson & Johnson, that made a lot of people uneasy, because they said, well, look, we'll see, it's causing these side effects and people are getting hurt, et cetera. But to me, it was actually reassuring that they stopped, as opposed to just like, oh, it'll be fine, just keep going, because that showed that this electronic database was really working, because there were only 6 women who were identified initially with those blood clots. So they stopped this whole multi-million-dollar operation after these 6 women developed blood clots. So again, that showed that this was really about patient safety and not about any type of ulterior motives. And then after they reviewed, initially they had 15 women that were identified when it was all said and done, out of over 3 million people who had received Johnson & Johnson. So after they did that review, then they came up with basically some language in the side effect profile that said, okay, well, this is safe to proceed based off of what our findings are, but you have to make sure that patients know that if they have this or that condition, that this is a possible side effect, et cetera. So just again, all of that to say that everything that is being done is being monitored very closely by the medical community. And there's a lot of oversight that is present. I know I just said the last thing I'll say, but for now, the last thing I'll say, this is the last thing. But
I have one more thing.
Right. But that oversight is particularly for us as African Americans. We get concerned about medical things that are coming out that are new, just because many of us, unfortunately, have not had positive experiences in getting medical care. We have a family member who's not had a positive experience with receiving medical care, and everybody's heard of the Tuskegee experiment and other wrongs that have been done to us over many, many years. But last year, all of the 4 historically Black colleges that were medical schools, including my alma mater, which is Meharry Medical College in Nashville, Tennessee, all 4 of the Black HBCUs formed a COVID task force. And they have been actively participating in vaccine trials on campus. They have been doing COVID research on campus, on all of their campuses. And then the NMA, which is the National Medical Association, that's the professional association of Black physicians in the country. They also formed a COVID-19 task force to review all of the data that came out prior to the approval of any vaccines. So we've had our hands in there to again make sure that things are being done equitably, that they're being done properly, and that there's not going to be anything that is going to be akin to us being experimented on or being treated unfairly or unjustly, as has happened in the past.
Okay, I have one more thing. I heard that one clinic, they're giving the Moderna, and for the first shot for vaccine, and then they're giving Pfizer for the next one. For the booster. How does that affect?
And so that I'm not sure why that clinic would be doing that at this point in time. The approval and the recommendation is still for you to keep that same vaccine, whichever one you started out with is the one that you are supposed to finish up with. And I see the question from Brother Blue with regards to, do you need 2 shots for it to be fully effective? So yes, if you get your, you get your first and second dose of Pfizer, you get your first and second dose of Moderna, then you do need both of those in order for it to be effective. Because essentially what the first dose does is it shows your body, and there's no live virus that is in the vaccine, so you cannot get COVID from the vaccine. But essentially there's a piece of the protein that has been duplicated in the vaccine. So your body sees that little piece of the protein and says, oh, okay, this is not supposed to be here. Let's make some antibodies, which are the fighter cells, against this. And then when you receive that second vaccine, the second dose of your Pfizer or your Moderna, your body has already started to make those antibodies, and your body says, oh, this is what we were supposed to be fighting against. This is not supposed to be here. And so then it really kind of revs up and makes more antibodies. And that's why a lot of times after people get that second vaccine, they do start to, maybe feel a little tired, or they feel maybe some chills. They just don't feel well, like within a day after getting that second dose, because your body's immune response has been activated, which is what it's supposed to do. So that doesn't mean you got COVID. That means that your body has these little fighter soldiers that are all revved up and ready to make sure that these foreign proteins are not causing an infection. So that would be the same thing that would happen if your body actually came into contact with the real COVID virus. You've got all these fighter cells that are ready to fight it off so it does not infect you.
Thank you. Pastor Manaway would like to either ask a question or give a comment.
Good evening, everybody. I simply just wanted to thank you, Dr. Magneto. Thank you, dear.
Yes, sir.
You blessed us tremendously. Thank you for your gifting.